Member for Manchester Withington for securing today's debate. Figures released today show that in Scotland there are over 3 deaths a day due to drug use. But who cares? I mean, who really cares? Who are these people that are dying? The homeless, the isolated, the good-for-nothing, the detritus of society. People who inject themselves with poisonous substances. They do it themselves, nobody makes them do it. How often have we heard these justifications? Nobody's saying it, not in this place, but we just know that some people are thinking it. Through a lack of compassion, but I think primarily through a lack of understanding, society has created a subculture of marginalised people. They are pushed to the fringes of our day-to-day consciousness. It has become far too easy to dismiss them, ignore them and exclude them from our cosy lives. Problematic drug users are not getting high for the kicks. They are self-medicating because the pain of everyday life is so great that without the drugs they couldn't live. The sickness isn't the drug use. The pain started long before the addiction. Of the 10% of drug users that develop an addiction, the vast majority have been physically, psychologically or sexually abused. Mix that with financial and aspirational deprivation, and you have a very powerful mix that takes very powerful drugs to suppress it. And that's why the support services must be about homelessness, mental health, security, continuity, understanding and compassion. Everything that counters the chaos. I visited drug consumption rooms in Barcelona, and I was particularly struck by one facility, a health centre where people visit their GPs for everyday ailments, and it's attached to a hospital that people can be referred to. One part of the health centre is for homeless people to visit and pick up clean clothes, have a shower and the guise of a shave. Over time, the staff built up a relationship with the clientele and came to understand why they are homeless and what can be done. Another unit attached to the health centre is a drug consumption room, and the staff there have exactly the same attitude as the staff of the health centre, the GP surgeries and the homeless unit. They want to know, what is your problem and how can I help? This is a million miles away from the stigmatisation that is so common in the United Kingdom. And the mindset of approaching a problematic drug use as a health issue pays great dividends. It is cheaper than pursuing and incarcerating people for drug possession. It frees the police up to fight crime. And most importantly, it works. Across the globe we know it works. Not for everyone. Tragically, there will always be drug-related deaths. But as we look at the figures released today, let us not forget that from naloxone available in DCRs, there has never been a death due to overdose in any DCR anywhere in the world. When will the UK government come to terms with this and either legislate to facilitate... Certainly.
I thank you, everyone, gentlemen, for giving way. He's talking about reform drug laws, and actually on this issue, we probably have a lot of common. But does he understand that today we've had shocking figures in Scotland that show not only are they 3 times the average of the rest of the United Kingdom, which are all under the same laws, but we're the highest in Europe. So if he wants to approach it on a health-based solution, can he explain why after 12 years of SNP stewardship of our health service in Scotland, what can be done and what should be done working devolved and central governments together?
Because we're trying to change UK policy. It's a UK-wide, it's a Europe-wide, but it's a system that we've proven that the methods been used elsewhere in Europe have helped this situation. Glasgow stands ready to pioneer a DCR. It has a cross-party support from Glasgow Council. It has backing from the SNP Scottish Government and the NHS Greater Glasgow and Clyde are fully on board. What in the name of goodness is stopping the UK Government from joining us?